We got to move on to metastatic disease, but I can't leave this adjuvant discussion without saying the word exercise. How important is encouraging, and is that part of your drill with a patient? And give me some, what are you telling patients?
Now, we haven't taken 1,000 people and sort of give them a personal trainer.
They're doing that in Canada.
Canada
is doing that, actually.
Yeah.
But I don't know if it's like the Biggest Loser, real hardcore a personal coach and a personal chef. But if you take the people who have good lifestyle and people with bad lifestyle, I'm not sure where we would fall in. The magnitude of effect is probably as big as the
chemotherapy.
Yeah, it's not all about the drugs.
Are you using that as an option for patients? Are you saying, oh, we could take some chemo, or here's some Nikes?
No.
It's a twofer.
Do both.
Every patient that when I finish adjuvant therapy, after that I said, okay, we need to have a lifestyle discussion. So we sit down, and the first, patients come back for their scan. We say, this long term, increase your exercise, normalize your body weight, lower alcohol consumption, less red meat, more. Everyone knows what healthy eating is. We don't follow it necessarily. And I actually bring up the idea of aspirin, which goes probably too far here, but. There's more and more data, vitamin D potentially, there's more data emerging right now.
Really important in the survivorship discussion,
yes,
right?
Is
this piece.
And I think the appeal of this, I counsel patients during, in fact, the work from Meyerhart and Fuchs is that this matters during the course of the adjuvant therapy as well as afterwards. I think this empowers patients to have control over part of what their therapy, and I think it's incredibly valuable.
Yeah, Dan.
And for me, it's, you shouldn't have to have cancer to have a teachable moment about your lifestyle, but it is the teachable moment, and it's not all about the drug. I talk about it at the beginning when we start the therapy. It's, look, this is a change for you, but it's not just about me giving things to you. It's about you doing things for yourself. And as the data from the CALGB trial from Meyerhart and Fuchs, I think, are just very compelling.
Right.
If you're willing to take chemo, you should be willing to get out and exercise and eat right.
All right. We're going to talk medicine.